Assalamu alaikum. How are you everyone? Welcome to Park Medicos channel. Like, subscribe, comment and share our channel to your friends and everyone you know. Today we are going to discuss a very important topic, very important disease that may be rare in your country, your region, but it is very important and affecting multiple patients and too much important that we should must know each and everything about this disease. This is retinitis pigmentosa. We will discuss signs, symptom, treatment about this disease. And before going to discuss this disease in detail, I just want to say you that it is a disease of eye, especially retina of the eye. It affects multiple people with different presentations. So we are going to start our presentation about retinitis pigmentosa. Retinitis pigmentosa refers to a group of inherited eye diseases that affect the retina. The thing that I told you in start that it is inherited eye disease and it sorry it affect the retina, the layer retina, and then we will discuss which layer of the retina because you all know retina is consists of multiple layers. Retinitis pigmentosa causes a degeneration of photoreceptor cell in the retina, where it is going to degenerate photoreceptor in the retina, usually starting with the rods and progress to the cones. Rods are those cells that help us to see in the night time. So it will start with destroying these rods and then progress to the cones, sometimes known as rod cone dystrophy or retinal dystrophy. As these cells degenerate and die, patients experience progressive vision loss. Related inherited disease, there will be multiple inherited diseases that may correlate with this disease. For example, Bardet-Biedl syndrome, Best disease, choroidoma, keratoconus, and Leber congenital amaurosis. These are the diseases that may will be correlate with this disease. Then hereditary and RP, how it will be transferred. Retinitis pigmentosa is an inherited disease that has many different modes. Inheritance. Retinitis pigmentosa with any inherited patient may be either isolated, multiple family members affected, or isolated only one affected person. I know multiple people who are just a single person in the family affected from the retinitis pigmentosa, and there is no history in his family. In the non-sex linked or autosomal form, it can either be a dominant or recessive trait. In the sex linked form, called X linked recessive, it is a recessive trait. Autosomal 20 dominant 20%, autosomal recessive 37%, X linked 4.5%, and sporadic 38.5%. As you can see, that sporadic is maximum 38.5% from these figures. Now, what is Usher syndrome? About 3 to 6% of the children who are deaf or hard of hearing have RP. RP is an inherited disease that usually affects people as youth or young adults and worsens over the decade of life. When combined with deafness or hearing loss, the combination is known as Usher syndrome. What is Usher syndrome? Hearing loss combined with retinitis pigmentosa is called Usher syndrome. The eye, this is the basic structure of the eye, retina, multiple layers, lens, etc. And now these are the photoreceptor cells and there are multiple layers, rod, cones, and then multiple other layers. Pigmented retinal tissue. You can see here how this destroy the retina and make pigmented layer, pigmented columns. There is a specific appearance of retinitis pigmentosa that the people called bony specules. Then what will be the initial symptoms of the RP? Night blindness. This is almost the first and initial symptom of the RP. Every patient who is going to suffer from RP, first he will experience night blindness, then reduced sight vision or tunnel vision, peripheral vision, blind spot, clumsiness, discomfort in dark situation, people going to avoid in dark places, difficulty transitional from light to dark and dark to light, and light sensitivity. These are the multiple problems that they can be feel. Early stage of RP, this is you can see how these can see multiple things. but their vision is going to destroy. The black spot is showing that there is a decrease in the vision. And now this is the late and the more advanced. You can see just even a tunnel. Only they can see even just minute things, and all areas are dark. Now, what are the tests for RP? ERG measure the electrical response of the retina to flashes of light. It will be used, and there will be multiple other options people can also use. At some people diagnose it can be on the fundoscopy, some diagnose on the OCT, and these are can be done at any age, even as an infant, and then presence of RP can be detected before any visual symptoms appear. Those at risk for Usher syndrome and RP, who are the people? Those are the at the risk of RP and the Usher. Sorry, RP is hereditary and comes in a number of hereditary types with impact both the onset and the severity. Certain forms US3 are found in families of Scandinavian descent, especially those who are Finnish. RP is found among all races and more common in many close societies, including Caucasians, Native Americans, and deaf cultures. Types of Usher syndrome: Type 1 Usher, born deaf with a balance problem and usually required initial stages of the RP as children or youth. Then Type 2, born with mild hearing loss, no balance problem, acquired RP about 10 to 20, hearing and vision both deteriorate rather slowly. Type 3, born with hearing loss which deteriorate rapidly, normal balance, acquired RP in the teen years. Now, what is the treatment for the retinitis pigmentosa? I am very, very sorry to say that there is no cure for the retinitis pigmentosa in US, in UK, even in the whole world. There is no cure. Multiple people, multiple researches are going, but there is no cure. Vitamin A for people with Usher syndrome and retinitis pigmentosa. A daily dose of 15,000 IU of vitamin A palmitate only has been shown to slow the degeneration of the corn ERG. A blood test must be taken to a certain liver function and the vitamin A level in the blood before taking this treatment. Multiple people are using vitamin A, but it is not too much effective that vitamin A is going to cure. But maybe it stops, not stop, but just slowly progression of this disease. Promising research. These are the multiple research that multiple people are going to done. Some are nutrition, some are retinal transplant, some are gene therapies and retinal transplant. The cell in the transplant must stay alive for a long time, preference for all the life of the recipient. These are the things that they are thinking that if we do transplant, then what we will be need. Those cells must have and maintain the light sensitive sensing activity of the normal healthy retinal cell. Those cells must transmit electric or the electrochemical signal to the brain, which brain can interpret as experiences of the vision. But these are all in the trial, gene therapy and the stem cell. These all are in trial, but there is no scientific proven or any evidence that these are going to support the cure or the treatment of the retinitis pigmentosa. And now I'm going to discuss that how the person who is suffering from the retinitis pigmentosa is suffer and how he will present bright, intelligent, motivated person. These are mastered at bluffing, optimistic, and the confidence on the outside, fearful in the inside. They are inside fearful about the even what will be going to happen, but they show the other people that they are strong, they are brave. Classic tone, communist become overachiever, often trying to test or prove themselves, often very, very socially outgoing in the daytime, but rarely go out at night. They are prefer to go at daytime, but at the late stage, they will be try to prefer sit at home, never travel, just few moments with their friends, even etc. Rarely go at night because of the night blindness, reluctant to accept blindness. This is natural phenomenon that no one is ready to accept his or his deficiency. Application from employment vision loss is progressive, difficulty adjusting to various lighting conditions. Balance issue for some people with US really good at faking it, reluctant to admit that they can't see something safely used, need more help than the admit. How we can prevent routine eye exam, exercise regularly, monitor blood pressure, don't smoke. You know, smoke is the root of the multiple diseases. Eat colorful food, veggies, fighting vision. Those contain vitamin A. Wear protective eyewears and consult your doctor before taking vitamin supplements. What else can a consumer do? Genetic testing and the counseling, participate in the clinical research. These are the things that a person can do who is suffering from the retinitis pigmentosa. This was all about retinitis pigmentosa. Thank you so much, all of you, for your listening. If you like, kindly comment, share our channel, and we will going to discuss a new topic in our new video. Thank you so much.